Hi, I am Tiffany Matthews, and I'm founder and CEO of Live Better Boomer Healthcare Advocacy. It's a company that was born out of a situation that happened with my grandmother during the end of her life while she was, in hospitals, nursing facilities, different things. A lot that goes on in healthcare is not good. It's not good at all. But for the things that do happen, many people have no idea how to handle it or what to do, or they're not prepared for a healthcare crisis or anything that can happen in an instant. Well, that's why I'm here. When I helped my grandmother with her situation in the hospital, I thought to myself, how many other people need the assistance of an advocate, of a person who champions your cause while you're in the healthcare system? A lot of people do. And having been a social worker for almost 2 decades in healthcare, I've seen it, and it's horrible. I've had to be party to things that made my skin crawl just to keep my job. I've had to do things that, would I do, those things to my own family? No. But because of those things and those negative actions, I formed LBB. The catalyst was my grandmother's situation. She was at end of life and in and out of the hospital quite a bit. And, there wasn't really much that we could do for her. And I lived 300 miles away. I couldn't help at all. My family was confused. My mom, as caregiver, was completely frazzled. And it was just a lot to take on, beyond the fact that we had to mourn the fact that our matriarch was dying. It was really tough. My grandmother was a champion to me, and she showed me love and showed me that, life doesn't have to be that bad. So for that person, I had to step up and help her in her time of need. I had to do it. There was no other choice. And that's how I feel about being in business now. There's no other choice for me. I've dedicated my career to helping people get the best health care possible to them. Don't you pay an arm and a leg for it? Between premiums and co-insurance and co-pays and all these other deductibles and all these other things you have to pay into insurance just to have access to care. Don't you think you pay enough to get the best possible? I'm sure you do. I know I do. So, I'm here to help you. I'm here to let you know that as a patient or a caregiver for a patient, you have power in this system. That's something that the system doesn't want to let you know. They want us to be moved along on an assembly line so other people can come in and be more profitable, so to speak. It's the truth. I've been there. I've participated in it, in the machine called healthcare. And there are so many things that people, even the smartest people, are not aware of in how healthcare works, and not aware of their patient rights or responsibilities. It can't all be on the healthcare system. It can't all be on providers. Patients have to step up as well, or their caregivers have to step up as well and take on their responsibility to get better care. It can happen. It is possible. I teach people regularly how to advocate for themselves and their loved ones. It's a skill that lasts a lifetime. Once you learn it, once you put the effort into it and learn it, you can use it forever, and change the health care you receive permanently. One thing that I understand is that a lot of people are not sure about what advocacy is. That's fine. Advocacy, and why I call myself the patient guardian because I'm an advocate. Advocacy is championing the cause of a patient during their time in the healthcare system, whether it's for a hospital stay, an appointment, a meeting, procedure, surgery, anything. You have to know what to ask, what to say, what to do in those situations to make sure that you maximize your opportunity to get the best health care possible. It can be done. You have to learn it. I'm here to help you. As a private advocate, my only concern is for the patient. Many advocates, that work in facilities like hospitals or medical offices, yes, their concern is for the patient. However, they can only go but so far because they work for that doctor. They work for that facility. And if profits over patients is the model that we have in our country for healthcare payment to providers, well, it seems like it's calling for more quantity versus quality. I personally believe that payment should be based on outcomes, but that's an entirely different talk show. I want patients and caregivers to know that you are the ones that fuel healthcare. I believe nurses are the lifeblood, they're the oil of this engine, but patients are the fuel, and patients are the ones that come in for care and pay for it. If that doesn't happen, we don't have a healthcare system. And in this system, patients are customers, period. You're a patient and you're a customer. You are a healthcare consumer. So one of the responsibilities that patients have is to act as a customer. If you're at a restaurant and you order a steak and you get a pork chop, you're not going to be happy with that. And you're going to send it back. It's the exact same concept in healthcare. If you don't like something that's happening, you have to speak up. You have to let them know that you're an active and involved patient. There's just no way around it. The squeaky wheel gets the grease, as my grandmother used to say. That's how it works in healthcare. There's no way around this. The ones that were active and vocal when I was working in hospitals or nursing facilities, they were labeled troublemakers. You shouldn't give a damn what you're labeled. The goal is the best health care possible and to maximize your health. So I want you to know that I'm here to help you. And I want you to know that I'm going to help you learn about advocacy and learn about ways to handle doctors, communication, care coordination, advanced directives, fall prevention, all kinds of different things. I am here because I am going to be a part of revolutionizing healthcare. I am going to help patients do that. Having been an insider, I know how they can do it. And this is what I'm here for. I have dedicated myself to patients and caregivers, and that is it. I'm not associated with any company, any corporation. I'm not getting kickbacks so I can promote their services. I am here for patients, period. Now, knowing what I know about healthcare, I'm willing to talk to people to help you with your healthcare. And there is a way that you can set up a time and chat with me, and I can recommend what you may need or let you know how LBB can serve you. So you can either go to lbbhealthcareadvocacy.com and take a look around, get a little comfortable, find out what I do and who I am. And even if you don't work with LBB and you need an advocate, please hire one. Just hire one with the education and experience that you need, the training, the ability to work with doctors. You don't have to get advocacy from me. You don't have to learn how to advocate for yourself from me. However, if you need help, please get it. Please get it. Healthcare is not designed now for patients to win. So you can contact me at lbbhealthcareadvocacy.com, or you can set up an appointment with me for a call at Calendly, calendly.com/LBB/call, and set up a time where you and I can talk and figure out what it is that you need to maximize your health care and to be able to spend less time and less money and less energy in trying to get the best health care possible. I'm here to help you with that now. I've done it for you. So give me a shout. Feel free to peruse around my website, and just know that there are wonderful people out here to make sure patients and caregivers have the rights that they are afforded to. So thanks. Again, I'm Tiffany Matthews, patient guardian, and I am founder and CEO of LBB Healthcare Advocacy. Here's to your health.